Hello, and thank you very much for joining the New England Baptist Hospital webinar series. We're very happy to have you here today. As most of you know, we are a specialty hospital and the only one in New England that works exclusively in orthopedic care. We see the largest volume of orthopedic cases in the area, and we have achieved a unique level of expertise, not only seen at the surgeon level, but also from all the medical staff that is involved in caring for our patients. This knowledge and expertise is what we would like to share with you through our webinar talk today, because we believe that education and knowledge will empower you as a patient to make the best decision relative to your health. We hope you find this webinar helpful, and we thank you very much for watching.
Hello, my name is Dr. Sharon Bassi. I'm a physiatrist at the New England Baptist Hospital Spine Center, and today we'll be talking a little bit about lower back pain, the common causes, and some of the common treatment modalities that could be used for this very common condition. So just as an overview, back pain is very common. It's the second most common symptom-related reason for clinician visits in the United States. At any given time, up to 84% of adults have lower back pain, which the majority resolves without doing anything at all. For some individuals, back pain is a recurrent or chronic problem that causes significant pain and impairments in quality of life and work. And for these individuals, seeking medical treatment is appropriate. There are certain risk factors involved in lower back pain: smoking, being overweight, older age, female, physically strenuous work, and on the contrary, overly sedentary work can be equally detrimental to the lower back. Low educational attainment, psychological factors, job dissatisfaction has also been shown to be a risk factor. So what causes low back pain? It's not always clear on initial presentation, and sometimes it takes many visits with your provider to come down to the diagnosis. It's a little unlike other medical conditions. Important considerations when you're determining the cause of back pain include the history of the back pain. When did it start? What makes it better? What makes it worse? Is it confined to the lower back? Does it travel down the leg? All of those pieces of the history are very important in determining the diagnosis. Also important is the physical examination, which can be performed by a spine specialist, and even other specialists can help with this, but physical examination can really help to tease out if there's any problems with the nerves or any problems with the joints in your back. Imaging such as x-rays, MRI, CT scans also contribute in developing the overall picture of what's going on with an individual. So overall, not one factor is more important than another. It's a combination of these three key factors that provides the best predictor of what is causing an individual's lower back pain. And it's important to keep in mind that oftentimes there's more than one source of back pain, especially in individuals who have had back pain for a number of years, which we call chronic. There is usually more than one pain generator. So herniated discs are identified in many individuals who have no pain. And I put this slide up here to sort of stress the point that an MRI finding or a CT scan finding does not necessarily explain why somebody is experiencing back pain or not. You may see findings on an MRI that have no bearing on an individual's clinical condition, and on the contrary, you might find MRI findings that have significant bearing on an individual's clinical condition. So taking the imaging findings into the entire context is very important. So the best way to conceptualize the causes of lower back pain is to divide it into two separate categories. One is mechanical, one is non-mechanical. So I'll briefly touch upon non-mechanical sources of back pain because these are quite uncommon, and less than 5% of individuals will have this type of etiology. So neoplastic, which is cancerous, infectious, or inflammatory conditions account for very few sources of back pain. More commonly, what we see is what we term mechanical low back pain. And this is what we generally term wear and tear, arthritic, degenerative type of conditions. So just to elaborate on the non-mechanical causes of low back pain, there's quite an extensive list here. But again, these are relatively rare and are not seen very often. A careful history can sometimes help to eliminate this as a source of back pain. So we're going to really focus this more on mechanical low back pain because that's the more common sources of back pain. And this can include lumbar strain, degenerative disease, herniated discs, fractures, and we'll get into that in a few more slides here. So quite commonly, we see lower back strain or sprain, which is, pain that comes from muscles and ligaments. Oftentimes, we will see this condition in individuals who are pulling, lifting, twisting, or doing certain repetitive activities. Sometimes you will see the muscles become deconditioned, secondary to being sedentary from any cause back pain. Degenerative disc disease is a very normal process of aging and wear and tear of the spine, and we see this in many individuals. It doesn't always have to be a contributor to low back pain. It can be seen in asymptomatic individuals with no pain, and on the contrary, we do see it in many patients who have back pain, oftentimes chronic. Another source of back pain that's fairly common is facet joint arthritis. So in your spine, you have little tiny joints called facet joints, no different than the larger joints in your body in that they are true synovial joints. However, they're a lot smaller and they occur in your back. These joints can become arthritic and they can cause pain that's confined to the middle of the back or either side of the back. Sometimes folks will have lower back pain, and in addition to that, they will have pain radiating down either or both leg. It can often feel sharp or burning. We term this sciatica as sort of a general term to insinuate any type of nerve irritation. It can be due to a disc herniation. It can have other sources as well. Oftentimes, coughing and sneezing or bearing down can increase leg pain in individuals with this type of pain. Another source of back pain that we will see is spinal stenosis. Oftentimes these individuals present with not only back pain, but pain that radiates down oftentimes the back of the legs. And this is oftentimes caused by narrowing of the spinal canal. So the center of the spinal canal contains many tiny nerve roots. And because of arthritic conditions that develop over time, those nerve roots get stuck into tiny narrow spaces that eventually lead to symptoms of back and leg pain. Less common causes of back pain, but those that we still do see sometimes in the clinical setting, are sacroiliac joint dysfunction. This is a joint that lives very close to the spine, and sometimes because of malalignment or because of irritation of the joint, sometimes because of postural derangements, this joint can get irritated and be a source of back pain as well. We sometimes have individuals present with pain in the spine that comes from a tear in the disc. So if you look at this diagram here, the center of the disc is quite hydrated. It's more of a aqueous type of solution as opposed to the outer part of the disc, which is composed of fibrocartilaginous tissue. So this fibrocartilaginous tissue does contain real nerve endings. So if you have a tear in that, that can lead to back pain usually, which is confined to the axial or lower back region as opposed to radiating down the legs. There is a debatable source of back pain called the back mouse, which is a fat herniation through the fascia, which is connective tissue in the lower back, and sometimes that can cause focal symptoms as well. Piriformis syndrome is a condition where the piriformis muscle, which is a muscle in the buttock region, can become irritated or tight, and sometimes that can lead to compression of a nerve that runs through that muscle called the sciatic nerve. So piriformis syndrome can lead to buttock pain by itself, or it can lead to buttock pain combined with pain going down the leg. This is also a somewhat debated condition in the medical community, but we do see it in individuals. So a very important piece of The clinical encounter is the physical examination where your doctor will want to inspect your back, check your range of motion, do a good neurologic exam where oftentimes your strength will be assessed, your ability to feel sharp and dull sensations in your legs or arms will be checked, and your reflexes will be checked. And sometimes when you have abnormal neurologic exam, that may indicate the need for more extensive imaging or possibly even surgical referral. So I'll switch gears and get a little bit into the treatment of low back pain. So I'll start by saying that the majority of individuals can be treated conservatively. In other words, the majority of individuals who present with low back pain do not need surgery. The goals of treating low back pain are to reduce pain, to increase functionality, and to improve quality of life. We have many different options for treatment for patients with low back pain. These can include modalities, which we term things like heat, ice, use of electrical stimulation, and that sort of treatment, which can be helpful more in the acute phase when folks present with very intense pain initially. As symptoms start to improve, our philosophy here at the Baptist is to get people moving and get them back to their normal, regimen sooner than later. And to that end, physical therapy has a strong role to play. So physical therapy really should be more of a strength-based program that works on reconditioning the spine, building back those muscles, and helping to desensitize those nervous system that has kind of been irritated, and also to lower the pain thresholds. So, for instance, some patients present with pain just with walking or just with sitting for short periods of time. So the goal of therapy is to allow you to sit and stand for longer periods of time by way of strengthening muscles. Some patients will benefit from various different kinds of injections in the spine. These injections can be targeted towards those facet joints, towards the nerves, and they can be used to treat back pain as well as to treat pain that runs down either or both legs. Medications are sometimes used to help relieve symptoms. Simple medications like Tylenol or anti-inflammatories such as ibuprofen, Aleve, Advil can be very helpful. Short periods of stronger acting medications can be used when pain is intense, but we generally don't advise using these medications long term. Another treatment option to consider is spine surgery. This option should be explored after careful discussion with your spine doctor and your surgeon. So to summarize, there are many potential causes of low back pain. A specific cause cannot always be reliably established for most individuals with low back pain, at least initially. Oftentimes there is more than one cause, and especially in individuals with chronic symptoms that have been going on for more than several months. A careful history, physical examination, and imaging when necessary will help your doctor determine the most likely source or sources of back pain in you. The reassuring thing is that less than 5% have a serious systemic source. Thank you very much.
Hello, my name is Raymond Hwang. I am a spine surgeon here at New England Baptist Hospital. The second part of this talk will focus a little bit more on the surgical side. I'd like to talk a little bit about what I think patients should be thinking and potentially asking if they're considering spine surgery. So, should I have spine surgery? Well, I think that to answer that question, you need to have a little bit of an understanding about the anatomy of the spine. The spine is very complex. It involves a number of different structures, and also the geometry and the alignment of the spine is important. We all know about the bones and the discs in the spine, but in addition, the ligaments are a very important part of the spine. They provide stability and allow for motion. There are joints at each of the levels where the discs are, and they also provide the ability to have the bones move against each other. The muscles, the nerves, and other soft tissues around the spine all come together to provide the structure that allows us to move. Another characteristic of the spine that's sort of unique is the curvature and the alignment of the bones relative to each other. The spine typically has a very specific kind of curvature, and any abnormalities in that can lead to symptoms. On top of all of that, the spine also moves as you move. And so any abnormalities in any of these structures or the alignments can cause discomfort or symptoms with motion. So because of the overall complexity of the structure of the spine, it's not surprising that the symptoms involving the low back are very common in the population. The good news is that low back-related symptoms generally improve well with just time. Most patients don't need to have surgery. The body has a remarkable ability to heal itself. And as it's doing so, there are a number of supportive treatments that Dr. Bassi covered that we can provide to help improve the symptoms during that time. These include things as simple as rest and activity modification, to oral medications, physical medical modalities such as physical therapy are very important to maintain and maintain good spine health. Interventional pain procedures such as injections and other percutaneous or non-surgical treatments can be applied that can help relieve symptoms in the meantime as well. But if symptoms persist despite all of these efforts, then surgery can be considered. There are a number of things that surgery can be performed for, but we do know that there are certain situations where spine surgery tends to work better. Some of these situations are those where patients experience sciatica or shooting leg pain. When this occurs with a disc herniation that compresses a nerve that matches the symptoms, then we know a surgery to address that does a very good job of improving the symptoms. Similarly, sciatica or patients who experience claudication, where claudication is a symptom of achiness or fatigue in the muscles of the legs with walking. When patients experience this and have stenosis in their spine, a surgery to address the stenosis does a very good job of improving those symptoms. Dr. Bassi also touched on spondylolisthesis as well. This is a situation where the bones are not in the exact alignment that they should be in. Sometimes these bones can slip forward or to the side, and when this happens, stenosis can occur. Patients who have sciatica or claudication or back pain often experience good improvement with surgery in this scenario. Scoliosis or an abnormal curvature of the spine can also cause back pain, and surgery to address that tends to be very successful as well. There are certain situations where more timely surgery is recommended. One of those is when the patients develop a progressive neurologic deficit. This is a situation where, for example, patients will develop worsening weakness in a muscle group. If this occurs, then more timely surgery tends to be more beneficial. There's a relatively rare situation called cauda equina syndrome, where patients develop sudden acute onset back pain and leg pain, urinary retention or incontinence, stool incontinence, or numbness involving the groin area. When this occurs, very urgent surgery is typically recommended. But what is spine surgery? In general, spine surgery entails two basic procedures. One of them is a decompression. The goal of a decompression is to remove the pressure on the nerves of the spine. There are certain situations where bone spurs, cysts, ligament enlargement can cause compression on the nerves. And procedures like discectomies, laminectomies, and foraminotomies are performed to relieve the pressure by removing those structures that are occupying the space that the nerves would otherwise prefer to be occupying. The image here on the left is a picture of a laminectomy. This is a situation where we remove the back portion of the spine to unroof the canal. The yellow structure underneath the bone is the thecal sac. That's the sac that holds the spinal fluid and the nerves within it. By removing the bone, as depicted here, we're able to access the thecal sac and the canal and free it of any compression. The other basic spine surgical procedure is a fusion. The goal of the fusion is to link two bones which are independent to each other and allow bone to grow between them, such that after a successful fusion, the two bones have become one single bone. That's what's depicted on the lower right, where these two vertebral bones, where there was formerly a disc between them, now has bone growing between them. Fusion is typically involved the placement of some kind of bone graft, either a graft that can be harvested from the patient directly, or a bone bank bone, or a kind of bone extender or bone substitute. One or more of these are applied to the spine to help the bone grow across. Oftentimes, implants will also be used to help increase the rate of fusion. by applying screws and rods or other devices to try to hold the bones in place, we know through experience that that tends to increase the chance that a fusion will occur. In addition to those potential variations in the surgery, there are also various approaches to the spine to actually perform these procedures. So we can approach the spine through the front, through the side, through the back, or a combination of those depending on what the specific problem that needs to be addressed is and how what the surgical plan is. Not discussed here, but also potentially available is a disc replacement procedure. This has become more and more accepted in the cervical spine and may be an option for certain patients with certain issues. Here are a couple of quick cases just to demonstrate how these procedures may be used. On the left is a side view of an MRI of a patient's lumbar spine. The gray blocks are the vertebral bones, and the black or darker gray stripes are the discs. The patient in this view is facing to the left, so the front of the patient is on the left of the screen. There's a area behind the bones and the discs that run up and down. That's the spinal canal. That corresponds with the yellow structure we saw previously. The white in that area is spinal fluid, and the gray wispy structures are the nerves passing through there. You can see in the back portion of the second to lowest disc, there's a large bulge or herniation of the disc. You can also see how that narrows and tightens the spinal canal behind it. The other image on the right is a cross-section of the spine at that level of the disc herniation. You can see that there is a significant prominence of the disc pushing backwards on the left side of the spine, where the left is on the right side of the screen. And this is reducing the space where the nerve wants to be passing through. In this patient with severe leg pain, who did not get better with the non-surgical options, a microdiscectomy was performed, where that piece of disc and that area for the nerve was opened up, and the patient experienced significant improvement of his pain immediately after surgery, which is not an uncommon experience for a lot of patients. In this case, this patient has spondylolisthesis. On the image on the left, you can see that the second to lowest lumbar bone is shifted a little bit to the left or forward in the patient. That has led to stenosis behind it. You can see that the area for the spinal canal behind this level is very tight. It's so tight that the nerves above it are actually bunching up. On the image to the right, you can see how severely narrowed that spinal canal is. You can barely see any spinal fluid passing through that area. For this patient with low back pain and lower extremity or leg pain, he underwent a laminectomy or decompression, as well as a fusion with screws and rods, which we can see here in these post-operative x-rays. On the left, we have a side view of the patient facing to the right, where you can see the screws placed into the bone. And on the right image, you can see the screws again, and also the area where the laminectomy was performed, where the bones were moved and the canal and the nerves were decompressed. And this patient experienced very good improvement of her leg pain as well as her back pain. When considering spine surgery, I think it's very important to ask both your surgeon and yourself a number of questions to fully understand the purpose of the surgery and what to expect. I think fundamentally it's very important to understand what exactly is causing your symptoms, what in your spine structurally is leading to your symptoms. By understanding that, you can have a better understanding of which of the surgical options makes the most sense for you. For any specific spine problem, there are oftentimes a number of different options, both in terms of approaches and also implants that can be utilized to perform the procedure. It's very important to understand the benefits and the drawbacks of each of these options and consider them based on your personal preferences, your objectives, and your lifestyle to decide which one makes the most sense for you. It's also important to understand the primary objective of the surgery. There's certain things, certain symptoms that spine surgery is better at improving than others. And it's important to understand from your surgeon which of your symptoms will improve more reliably than others and what to expect in terms of results. It's also important to understand what are the chances of improvement. For example, low back pain tends to be more difficult to improve with spine surgery, but symptoms related to nerve impingement such as sciatica or claudication tend to be more reliable. It's important to discuss these chances with your surgeon. Spine surgery is a very serious undertaking, and although complications are rare, there are certain risks that, if they occur, can have a significant impact on your life. So it's important to understand all the risks involved with the procedure that you've selected. And finally, I think it's also important to discuss with your surgeon very thoroughly what the recovery process is after your procedure. The surgery itself is just a small portion of the overall treatment. The recovery process will undoubtedly involve some degree of activity restriction for some period of time, as well as rehabilitation afterwards. And it's important to have a good idea of what to expect in terms of that post-operative process prior to undergoing surgery. There are also questions that I believe you should ask yourself during this process. It's important to consider how disruptive your symptoms are to your daily activities. Spine surgery is very effective in improving patients' discomfort, but it's not possible to guarantee 100% improvement. Taking somebody from a 10 out of 10 pain to a 3 or 4 out of 10 pain will have a significant impact on their life. But decreasing them from 2 out of 10 pain to a 1 out of 10 pain may not be significant enough to warrant the risks of surgery. Do you understand what the problem is that is causing your symptoms? It's important to understand the anatomy that's leading to your symptoms to be able to choose the correct procedure. So therefore, it's also important to understand how the surgery will deal with those anatomic problems so that you can choose the best procedure for you. Do you have an understanding of the recovery process? It's important to have the correct expectations for how quickly you can return to your work, return to your activities, and also understand how long it will take to sufficiently rehabilitate yourself after surgery. And also important is making sure that you have sufficient family and home support after surgery to help you during the process, because you will be unable to do certain things immediately after surgery. So in summary, the spine is a very complex structure, and similar symptoms can arise from very different diagnoses. Certain combinations of symptoms and diagnoses are more reliably treated with surgery than others. In general, spine surgery is most appropriate when symptoms do not improve with sufficient time or non-surgical treatment. There are certain situations where more timely spine surgery is recommended, as we discussed, and a thorough understanding of the surgical options, the risks, and the postoperative course are important prior to making a decision for surgery. Thank you.